Hello, beautiful people. Welcome once again. It is a beautiful Saturday morning, although it is cold. Thank you for tuning in to the fourth model in Black maternal mental health. So, in this model, we are going to discuss culturally responsive care for Black maternal mental health clients, understanding and supporting their diverse needs. Um, so, we're going to delve into some of these issues that we deal in society, taking care of these group of women. So I want to remind everybody that in doing these programs, it's online, and my intention is not to minimize anybody's experience or experiences. So every time you come into my space online, it is a safe online space to have conversations about mental health. And we are here because we need to support each other, either physically, mentally, emotionally, spiritually, as human beings. We are here to learn what we don't know. And also a reminder, please do not share your private information online, and it is a live recording. So if you need to connect with me at any point in time post, please email me, and my email is there, philjo@live.ca. The intention of this webinar is approximately 45 to 60 minutes. So that is what I will try and get through, or hopefully earlier, so you could do whatever you need to do. So be reminded that this is a safe space. So if y'all don't know me, and I don't expect everybody to know me, yes, that is me in my Africa t-shirt. I am an obstetric nurse or labor and delivery nurse, and I have been a nurse for almost 2 decades now. I have been a nurse in mental health, in geriatrics, in done community nursing. I've been around, but the majority of my work as is maternal health, and I have a keen interest in Black maternal mental health, amongst other stuff. So I combine storytelling, this webinar, everything, all my experiences to bring together to teach. So when you meet me, when you see me, yes, you see that there's a different depth to me, because I bring everything that I have on the table. Now, wherever you are that you are watching us, because I'm coming to you from a town called Brantford here in Ontario, Canada, I need to acknowledge the land that I am on. So I'm going to read out the land acknowledgement, and then we can proceed into it. So I acknowledge that I live on the lands of the territory of the Mississaugas of the Credit First Nations, Six Nations of the Grand River, and the traditional territory of the Atinderwek Grand River Haudenosaunee. I'm reminded that Brantford is situated on the lands that are full of rich indigenous history and home to many First Nations, Inuit, and Métis people today. And I recognize and accept the significance of their contributions to the past, present, and future as land keepers and water protectors of this land. As Africans, or sometimes when you travel to somebody's land, you need to pay homage and acknowledgement to the chief and the chieftaincy, and to the elders and the people of their land. So this land acknowledgement is a late development, for instance, in the Canadian system or culture, but in within African systems and culture, you do understand that when you're a visitor into somebody's land, you do pay homage and acknowledgement. So we thank the Indigenous people of Canada for protecting the land that we are on right now. So, introduction. We're going to go through, the importance of Black maternal mental health, the disparities faced by Black women in maternal mental health care. And then at the end of this segment, the intention is that you'll be able to identify and understand culturally relevant or responsive care. And the goal is to equip providers with tools to deliver culturally responsive care. Now, within this, then we are also going to, you have to think about what culture means to you. We all understand that cultures are always evolving and that, we cannot know everybody's culture, but there are overlaps to understand different cultures. So we have to, be mindful and also understand that what are some of the cultural nuances that we may miss when caring for people who are not of the same background as ourselves, and also, identify what the root cause of our cultural biases are from. So we'll take a look at it from as race, whether it's from a race perspective or it's from racism. But many times, or most of the time, our cultural biases are based on racism and not race. There's also little understanding that we all come in with culture. Everybody has culture. There's a Canadian culture. There is the different walks of life. The Hungarians that come in with their culture. The Polish come in with their culture. I'm Ghanaian. I come in with my culture. The Nigerians come in with their culture. South Africans come in with their culture. So why am I saying all this? Because we're all coming from different cultures together, we'll need to understand that motherhood itself as a process can have its impact on the mental health of new mothers. And the transition alone can be challenging. So a person has to worry about, juggling time, juggling marriage, juggling finances, other children, family not being here, they being alone. So it's a lot that goes on in a person's life. So we need to be mindful as, caregivers or to our clients, what they're going through, and meet them part way. What is culture? I remember in introduction to anthropology talking about culture, introduction to sociology talking about culture years ago, and it hasn't changed much, the definition of culture. One thing that I would say is that culture is always evolving as we as human beings always evolve. Now, I took this quote of what is culture from Naomi Kipuri, who wrote State of the World's Indigenous Peoples, So she says that she identifies as that culture has been defined as the complex whole, which include the knowledge, belief, art, morals, law, custom, and any other capacities and habits acquired by man and or woman as a member of society. In other words, culture is a patterned way of life shared by a group of people. So, therefore, culture encompasses all that human beings have and do to produce, relate to each other, and to the physical environment. It includes agreed upon principles of human existence, which is the values, the laws, the norms, and the structures as we live by, as well as the techniques of survival technology. At present, I'm coming to you virtual. This is a virtual webinar, not a one on one. So, the technology that we use. So, culture is also the aspect of our existence which makes us similar to someone yet different from majority of the people in the world. It is the way of life common to a group of people, a collection of beliefs and attitudes, shared understandings and patterns of behavior that allow those people to live together in relative harmony but set them apart from other people. So, in short, or the long definition of culture. This definition goes in great depth to culture. As Canadians, we love our Tim Hortons. It's like a cultural thing. You get your Tims. Now, when you go outside of Canada, whether you black, blue, Chinese, whatnot, when you see Tim Hortons somewhere and you meet another Canadian, even if they don't come from the GTA area, but they come from some other part of Canada, when you meet, you identify as Canadians. You become excited because, oh, I've met my fellow Canadian. We have similar understanding of the cultural values and norms that as Canadians we espouse, and we go with it. All of us know Canadians, whether black, Chinese, whatnot, as you're Canadian, eh? It comes after that. And then the Canadian always please, sorry, sorry, sorry. So that is part of the ingrained culture that we are identified on the world stage as being peaceful people as Canadians and saying sorries. Now, how culture matters in Black maternal mental health. So, there we factor in cultural competence, cultural humility, and soft skills into care for Black maternal patients. But to do this, we need to understand that we need to have a greater understanding of culturally responsive care. So, for those of us within the care environment or the hospitals or doing home nursing, visiting nursing, public health, etc., we really need to understand culturally responsive care, what it means, what it looks like, and how we can, give it. So, cul- culturally responsive care is always ongoing. We don't know everything. I don't know everything. It's always ongoing and it's always being learned. So it's very, very important that we need to understand that we cannot achieve perfection because it's evolving, it's learning, and it's the same way as culture evolves. So the key principles we're going to look at is the awareness of cultural differences, empathy, respect, collaborative care, and cultural humility. And we're going to distinguish at a certain point cultural competence and cultural humility. Those two things are very key in understanding these principles. So, what is culturally responsive care? In in 1989, Terry L. Cross and colleagues came up with the concept of culturally responsive care. The term became more prominent in healthcare around the 1990s. Is that they realized that what, we're giving care to people. We're looking at everybody from the same bar, but people are coming from different walks of life. So how do we give them a better service, identify and catch people who need not fall into the gaps of our healthcare system, which many do. So that is where culturally responsive care came in, and that everything that we do is from a culturally responsive, standpoint. So it is defined as the care that respects diversity in our patient population, and that lack of identification of this diversity in patient population and cultural factors can affect healthcare. So that includes the language, communication styles, beliefs, attitudes, and behaviors. So, one ability to provide culturally responsive care is hinged on a critical evaluation on the self and biases. So, to be able to facilitate better care between clients, and patients, communication, which will improve outcomes, we need to be culturally responsive and identify some of these things. So, in retrospect, let's look at some of the factors that can impact some of these culturally, you know, care. So, that is lack of cultural humility, cultural oppression. Cultural oppression is thinking that one culture is better than other and superimposing your culture on another person's culture, therefore oppressing them that yours is better, which feeds into cultural bias, because if you are not culturally biased, you don't oppress somebody. This causes cultural threats in the sense that a person of minority feels that their culture is inferior because there's a superior culture, or they are shown or seen as not good. And then the cultural stereotypes. There's so many stereotypical ideas floating in the community that if you don't take care and you pull in all these stereotypes, you would it becomes problematic caring for people. At the in some of the slides I will share with you, I remember a nurse asking me in one of the Toronto hospitals that I used to work, asked me why there are so many black teenagers, having babies, and why black women have attitude and whatnot. And that is a cultural stereotype because there's a lack of deeper understanding of the journey, of the story of these women and how they have been here. So these factors are impacted by the way we think we know it all, and therefore lack of experiential learning. Let's get to how to provide culturally responsive care. So we understand that we are all not from the same cultures, but we need to take care of each other as human beings. So it involves one having the understanding that culture plays a role in how women perceive and prepare for birth. Say where I work now has a high low German population. How they perceive and receive birth, and say after birth, given vitamin K, erythromycin, it's different, and I acknowledge that. There is a cultural meaning, there is a religious meaning, and that is absolutely perfectly fine with me. Understand and respect that. Providing culturally responsive care is situated in the understanding for Black women that there has to be anti-Black racism in healthcare. So this means that we need to recognize our own biases as individual caregivers, and then understand the importance of providing care which is respectful of the patient's cultural beliefs, practices, and traditions. In fact, if you don't know, ask respectfully. Learning to listen more and talk less when clients are speaking, because half of the time we as healthcare givers think we know more than others, so we do tend to tell you exactly what we think it should be, but we need to learn to listen more and talk less when clients are speaking. And we also have to be open and willing to learn and not being judgmental. It is about the clients, not us. And also look at the differences in communication style, which means we have to be mindful of other people's communication style. And also that whether your client is an immigrant, and if they have an immigrant journey and the challenges they face as women in Canada. What are some of the ways to become culturally competent? Remember that I discussed that you don't just become culturally competent, it is a journey. So, since we know that one cannot know everything about about people and cultures being cared for, having an idea and learning from them what is important to them and how to assist them in achieving that health goal is very, very important. From what I have understood, that we tend to use a lot of medical terminologies, big words. Girl, I ain't no big word person. So we need to be able to keep it simple for women, and most especially women with limited English, women coming from other walks of life, to be able to get through to them. Um, we also have to practice cultural humility. I will explain cultural humility later, and also that our cultural biases may be in the way of providing culturally sensitive care. So as nurses, we should learn about, cultural values, beliefs, and healthcare needs of the people we care for. I am grateful that when I was starting work at where I am right now, I attended a conference for low German speaking people, because that is the biggest catchment area. And I got to understand their history. And as every day goes, I get to understand that the people I do believe are just low German are not just. There are different variations, different dialects, slightly different belief systems, and asking questions and listening to their narratives helps me, craft what kind of care to give to them. Which means that we need to avoid assumptions. Nurses should avoid making assumptions about patients. And I personally dislike getting reports and having assumptions about patients because they tend to be biased. And my experience with patients and other nurses' experience with patients are different. So I try as much as possible to go listen and have conversations with the patient to understand where they're coming from and where I can support them. It is important for us as nurses, as human beings, to reflect on our own biases. So, any student that have passed through me as a preceptor is highly encouraged to get a journal. And that is how my teaching is done. Those journals for reflection upon biases, on learning, and to help you grow as human beings who take care of other human beings. And that is something that sometimes we often lack because we are in it just to work and go, but a whole lot of biases creep up, and which is really bad. I've spoken about the language, and if you are able to work in diverse settings, it will be great to learn from different settings. A majority of my work has been in a very diverse area within the GTA. So I have had it all from God knows, people from Turkey, from Uzbekistan, and Egypt, Libya, Morocco. In fact, that is the best part of the nursing, having fun learning from nurses. A recruitment of staff from different walks of different, diverse staff members, sorry, is also key in being able to ask, how is it done here? What do you think? Or can you explain it in a language that this patient understands? Most especially if the nurse is from that region or understands the language, can do the translation, and can do comparison of knowledge. Further on, ways to become culturally competent is sharing. Share a little bit about your own culture, and that you can share something that may be similar to the patient's culture or maybe different. It's like, in my culture it's done this way. Oh, in my culture it is done this way. In that you learn from different cultures. Learn a new language. Now, don't be like me, trying to learn German and to speak to lower German people, and it's two totally different languages. It was just a bust. But when I have that conversation with them, it becomes a source of, laughter. That it's like, oh, you were trying to learn German. Yes, I was trying to learn German so that I can communicate with you. If possible, try to learn a different language. Ask them, how do you say this, how do you say that. That is also bridging a gap of care. Reach out to clergy to understand different faith in community if you don't understand. Complete your continuing education courses. There are so many courses on culturally competence, cultural humility, and all those things. I know Public Health of Ontario has a video on cultural humility that is very enlightening. So, and work with community leaders if there's the opportunity to do so. So there's so many ways we can become culturally competent ourselves and not being fully dependent on the institutions that we work with. So I've been speaking about cultural humility. So understand that it is a process of self-reflection to understand the personal and systematic biases and to develop and maintain processes and relationships based on mutual trust. Cultural humility involves humbly acknowledging oneself as a learner when it comes to understanding another's experience. This is from the First Nations Authority based in BC, Vancouver. And I love it that it is based on acknowledging that as a learner, you are working to understanding another's experience. So, what does cultural humility do? Cultural humility helps us create a culturally safe space for our clients and understanding that it's a lifelong process of self reflection and learning from others. So, here's the difference between cultural competence and cultural humility. Cultural competence is the ability to work respectfully with people from diverse cultures while recognizing one own's cultural biases. Listen, I'm Ghanaian by birth, been here for a long time. Not everybody is Ghanaian that comes from my culture. So it needs to be very clear that to be competent, I need to check in my cultural biases. It's the same way when I was in Sierra Leone. I needed to check in my cultural biases as a Canadian experienceness going on a mission in a different country. So always being mindful and checking in your cultural biases. And then cultural humility on the other side is the ability to recognize one's own limitations in order to avoid making assumption about another's culture. I do love one of the physicians that I work with, and we were talking about cultural competence, cultural humility, and our own biases. And he did tell me that sometimes it's difficult for him not to say anything, most especially when he's done the teaching and he realizes the patient is unwilling to make decisions that he thinks it's the right decision. He has to check his biases and keep quiet and go out and rethink that this patient is capable of making the decisions. He has given this patient the maximum education and knowledge to make an informed decision and step out. And for somebody to be like that, I understood why we love him and why he's great at doing what he does because he checks in on his cultural biases. So you need cultural competence and cultural humility both to work together for individuals, to make a change. Now, one of the factors or the things you need are part of the set of soft skills. So in the soft skills webinar will be coming out shortly, but active listening is one of the key principles that you need as a care provider or any provider caring for people in the healthcare field. So some of the soft skills that you need: ongoing learning and self transformation to achieve cultural competence involves active listening. So, which means that you need to be fully present to the words, emotions, and intentions of your client. You're not just there doing stuff. You take a seat, sit, listen. You create an environment that is without distractions. So if you can put your ASCOM or your cell phone or all these things, and you can ask, and your other colleagues for 5-10 minutes with this clients, that is creating an environment that is free from distractions as best as possible. Or communicate with the client that you have 5 minutes or 10 minutes to sit and listen. You are listening to them and do not interrupt them when they are speaking. And if you interrupt, it is guiding, not castigating. So this creates and nurtures genuine communications during conversations, and it also fosters trusting and respectful relationship, helps resolve conflicts with greater understanding, and helps with emotional validation, which is very important for Black maternal mental health. If we believe that the nurse, whether you're Caucasian or another Black woman or Chinese or whatnot, Iranian, Iraqi, is listening and paying attention and not being judgmental, these women get out of there and they are happy. And at the end, you have done your job. So, what is cultivating cultural awareness and respect? Cultivating cultural awareness therefore demands that we educate ourselves with different cultures around the world through reading, through conversations with other people from cultures that are different from ours, or watch documentaries about how other people have birth around the world. And back again, we need to identify our cultural biases and stereotypes of others. So without this, you cannot get into cultivating cultural awareness and respect. It is very important. So respect for other cultures means that you are open-minded to understand that different cultures practices and live differently according to their sense of meaning in life. Now, to do that is having a reflective awareness, which means that you have to be reflective awareness involves empathy, active listening, cognitive mechanisms contribute these contribute to implicit biases if you don't have that. So you need to be aware of those. It fully considers the cultural backgrounds, values, and preferences of individuals, groups, and populations, so that reflective awareness and cultural responsive care goes beyond being just aware of your culture, but it ensuring that all aspects of healthcare are customized to address the needs and beliefs of specific populations. And remember, it is always evolving. So, empathy involves having an awareness of people's emotions, feelings, and experiences. And it's also one's ability to give empathy gives a person of a sense of being seen and heard, and that's their experiences being validated. So, how do you practice cultural communication? This is very important because within we tend to miss a lot here. So we need to assess how we communicate with others. We need to assess our beliefs. We need to reassess our values and our practices. And we need to be aware of the differences in cultural communication, such as body language, the voice, volume, gestures. All these things we need to be mindful of all these when we are speaking to people. So let's jump to. So if you're a person of, if you a black person and you are searching for care, um, you need to voice out what concerns you and ask for help. I'm going to say that support after childbirth to combat some of the challenges of coping after childbirth. There are some social services that are available, and unfortunately, some of my people don't know, and many immigrants may not know, but there are some support services there, albeit not all geared towards black people, but at least it's a beginning. There's also breastfeeding support, most especially for maternal, new black mothers, the utilization of family and friends, and getting help or checking out your community. And some communities have community of mothers to assist them in this. I think I spoke about this particular session in my previous slide. So let me jump to strategies for culturally responsive care. Strategies for culturally responsive care. So for the institutions, these involve education and awareness to learn more about Black maternal mental health, to build trust through active listening and validating experiences, to engage for community engagement with community engagement, which involves partnering with Black led organizations, which in a couple of slides coming, there are some information that I put in there. Addressing biases, so addressing ongoing training to reduce implicit biases. Oops, that's a mistake. And then tailor interventions using culturally relevant tools. So, in doing so, you create a safe space for these women by encouraging open communication, respectful cultural practices and preference, using inclusive language to understand and also understanding the impact of cultural threats and the impact of implicit cultural bias. What is cultural threat? Let me kind of go over this a little bit. So, cultural threats can be perceived as harm caused by differences in culture or destruction of cultural heritage. So for instance, um, I'll use the U.S. As an example. When for for Canada, we think about it as a diversity and inclusive space where all cultures are respected. For the US, what has happened is that the dominant Western culture supersedes on every other culture. So, bringing other cultures down, everybody has to be fit into the melting pot. Now, let me take it to Indigenous here. The destruction of cultural heritage within Canadian system, within Indigenous societies, is massive in that Indigenous cultural practices has been erased through a system of patriarchy and colonization. So we're now trying to bring it back, partnering with indigenous societies to learn more as they are also relearning. So those are some of the things that you think about the destruction of cultural heritage that has massive impact on the community and people. So as we're talking about culturally responsive care, what it is, for me personally, and maybe others or not so, let me talk about myself. It's a lifelong commitment to self-evaluation and self-critique. So when I put it on others, then it's that we not only learn about our culture, we learn about others by examining ourselves and recognizing that the power dynamics and imbalances. If you get a client coming in as a healthcare professional, you got to understand that number one, there's an imbalance. You wearing the scrub, they are at your, for lack of a better word, mercy. You are taking care of them. They need you. That is why they're there. That does not mean that you disrespect them. So if they come and you caring for them and you don't know it all, there are community resources. So we need to learn about the community resources around to be able to take cater for these women. So leveraging on community resources, you can collaborate with doulas, midwives, mental health advocates who are biopic, and other immigrant nurses and nurses who do international work. Within where you work, you will find nurses who do international work, who may not be Black, but have done international work in Black communities around the world, whether it's in the Caribbean or on the continent of Africa. That opens a worldview. Nurses who are immigrants like myself. And I always say I speak a couple of Englishes. There's this English I speak, and there's the African English that I speak to my people who understand. So sometimes you need a nurse who understands, who can break it down to the nitty gritty, whereby the client will understand. You also have to be able to highlight culturally relevant support groups and services, just like what I have discussed. There are some Black doulas. The information is there. I will add it. You also have to be able to integrate holistic approaches, which is either spirituality, family involvement into care, languages, approaches. Like when we speak about spirituality, some people want to oil themselves and pray and whatnot. Create that avenue. If you have a patient who is Muslim and needs a little bit of prayer place, whether daddy family, they sometimes ask you where is east. You point east to them. Give them the room to pray, or show them where to go. All these are part of culturally relevant care. And ask for Black maternal mental health patients when they live in the hospital. Ask if they know of community resources that take care of, that have the community mothers, to so to speak, those places. Now let's look at the role of advocacy, of policy and advocacy. There are there are now at present, advocate advocates calling for Black maternal mental health, because in the broader literature we are missing. So we are learning to speak and tell our own stories and do the research that will identify and advocate for us. So we are advocating for equitable healthcare policies, supporting funding for Black maternal mental health research, promoting diversity in healthcare workforce, ongoing training on CRC, and decreasing gaps in outcomes. So CRC is culturally relevant or responsive care. So all these conversations are really important if we need to get anywhere. So there are some tools and resources that includes, Black Mamas Matter Alliance, which is an international organization for nurses who need resources, you can go there, and Postpartum Support International as well. Within Canada is the CAMH has a CMHA, Canadian Mental Health Association, has information, Black Ottawa Connect, Women's Health in Women's Hands, Black Midwives, and Ontario Black Doulas Association and Taibu. All these have community tools and resources if you are willing to learn about, taking care of Black women in labor and support them to prevent, mental health crises and issues. There are support systems there. So let's go to on call to action. There is a need for cultural competence. So culture cultural competence training in institutions, ongoing learning by self. Institutions will do their best, but you also, as a healthcare professional or anybody interested, any have to learn and also collaborate with the community and organizations that call for systematic change. They are there. You can do your search for them to get there. There are some references, and that is it. I will say a big thank you for listening, for tuning in. I will come back with a different webinar that speaks to soft skills, so watch out for it. Thank you so much for tuning in to Black maternal mental health and what culturally competent care is and how to provide it. I hope you have learned a thing or two from this conversation. And yes, be part of the solution to the problem, not the problem. It is possible to provide culturally competent care for all.